I have the pleasure of serving as your moderator for today's session. We are delighted to have all of you here for this special lecture entitled Getting Started in Qualitative Research, Working with Words Rather than Numbers. Before we begin, I would like to kindly ask everyone to keep your microphone muted throughout the presentation. Turn off your camera if your internet connection is unstable. Submit your questions through the Zoom chat box if you have a questions. And we will have a dedicated session later after the presentation. And also, please remain in the meeting until the end of the session. Today's lecture aims to introduce the fundamental concepts of qualitative research, including its philosophical foundations, methodological approach, and practical application in health and pharmacy research. Qualitative research plays a crucial role in understanding patients' experiences, healthcare professionals' perspectives, and the complex social context surrounding healthcare delivery. We believe today's lecture will provide valuable insights, particularly for students and researchers who wish to incorporate qualitative methods into their research. It is now my great pleasure to introduce our distinguished speaker. Good morning. We are honored to welcome Dr. Sara Garfield from University College London. Good morning, Dr. Sara.
Good morning. Yeah. Can I just check if everyone can see my slides?
Yes, I will introduce first. So Dr. Sara Garfield is an experienced researcher whose work focuses on healthcare quality, patient safety, medication use, and qualitative research methodologies within healthcare settings. She has extensive experience conducting qualitative studies involving patients, healthcare professionals, and health systems, and has contributed significantly to improving healthcare services through research. Today, she will share her expertise on how qualitative research can help us answer important research questions that cannot always be addressed through quantitative methods alone. So, ladies and gentlemen, please join me in warmly welcoming Dr. Sara Garfield. Dr. Garfield, the floor is yours.
Thank you very much. So I'm going to be giving a bit of an introduction to qualitative research today. Obviously, I can't cover everything in a 1-hour session, and I would often do this as a workshop as well, but we won't have time for the workshop activities. So I would encourage you to take this as an introduction, and hopefully it will spark your interest to read more as well after the session. So just wanted to briefly introduce a little bit about me. So I'm a lecturer in pharmacoepidemiology and drug safety, and in the UCL School of Pharmacy, I'm part of the Department of Practice and Policy. So I'm not a lab-based researcher, although I do work with a lot of lab-based researchers who want a patient perspective on the acceptability, possibly, of the products that they want to produce. So my research areas are about patient, carer, and healthcare professionals' involvement in medication safety. Key methodologies I use are qualitative research, survey, and also co-design. But today I'm going to be focusing on the qualitative methodology. I also have some other roles in the School of Pharmacy as chair of our local ethics committee and chair of our patient and public involvement panel as well. So today I really wanted to cover why do we do qualitative research, and explain really what it is and what role it can have, particularly in a pharmacy and healthcare context. I want to talk about, give you a bit of an overview of what qualitative research designs is, and then just think about one of the key methodologies of conducting interviews and also conducting focus groups, and talk a little bit about how to get started with some of those as well. Okay, so by the end of the session, hopefully you'll be able to list the goals of qualitative research and be able to say when the approach might be used, and also design a semi-structured interview schedule. So I wanted to start off with quantitative versus qualitative. I'm going to just come out a moment to see if anybody wants to put anything in the chat box about quantitative versus qualitative, or wants to come off mute. What do you understand by the difference between quantitative and qualitative?
Okay, so please, all of the participants, maybe you can answer it through the chat box. What is the difference between quantitative and qualitative research? Please.
Maybe it's well, I was going to say it's early on a Monday morning, but it's already the afternoon, I think, in Indonesia. Okay. I don't see anyone typing, so I'm going to carry on and explain the difference. So for quantitative research, we're very much thinking about numbers. So even in practice and policy research, we're thinking about, what percentage of people who took this medication had this side effect. Or we might be saying what percentage of people on a survey study said they strongly agreed with something. So sometimes people think that quantitative is about sort of pure not non-opinion things which aren't about opinions and see it as objective. But actually sometimes when we use surveys, they're often quantitative as well, because we're actually thinking about numbers, we're thinking about percentages, and we're not really thinking qualitatively. Qualitative research is more about words. So we're not interested in how many people said something or ticked a certain box. We're interested in what they actually said, how they expressed themselves, and what their views were. So quantitative research, again, this is a summary table, is about how much, how many, how often. It's useful to quantify, to measure, to count, to estimate, predict, and compare. And you often will use inferential statistics to test a hypothesis. Whereas qualitative research is asking what, why, and how. And it's often used to generate a hypothesis rather than to test a hypothesis. And the data you'll get from that will be more expressed in words rather than numbers. So instead of saying this percentage of people agreed with this, you'll say, this was a general trend of the way people expressed they felt in an interview, and here's some quotes that illustrate that point. So it's often used to explore and inform a subject area that we don't know much about already, and to understand more about people's views, experiences, and behaviours. And it can also be used, for example, in a clinical trial or a trial of a complex intervention. You might find that the quantitative data will tell you whether this intervention worked or not, but then you might need to collect some qualitative data to say why it did or didn't work. So you might find out, well, the intervention didn't work because there were problems implementing it, because patients didn't like it, lots of different reasons. Or if it did work, you might want to know what was it that was made it work, so that when it's moved to another context, you can retain those features. So it is a really important part of research, and it has its own place alongside quantitative data. You'll often use mixed methods and have some quantitative and some qualitative to get that bigger integrated picture. So I'm going to have another go to see if anyone wants to put anything into the chat. So if you think about a general research area of prescribing of antibiotics, think about what sort of questions might quantitative research establish, and what sort of questions might qualitative research establish. So I'm going to just come out of my presentation so I can see if anyone's typing anything in the chat. Oh, and I can see someone answered my question from before, that quantitative means working with numbers while qualitative with words, which was exactly it. So I'm just going to give a few minutes, see if you can think about prescribing and the difference. If you're thinking about prescribing, what sort of quantitative questions might you have, and what sort of qualitative? If you're too shy to put it into the chat, then think about it for yourselves. And I'm just going to give a couple more minutes. Okay, we've got somebody. That's great. So quantitative, how many antibiotics are used in healthcare facilities? And qualitative is, how is the perceptions of antibiotics? what are the perceptions of antibiotics that patients have. So, yeah, that's great. Thank you, Larasati. I'm sorry if I pronounced your name wrong, but that is excellent. Thank you. So we're going to just come back. So we see quantitative research might establish things by like what rates of prescribing are there in different countries, or as we saw in the chat, in different healthcare facilities, what conditions are particular formulations and doses used, and also you might have an inferential hypothesis in there, how prescribing practices differ between settings. And qualitative ones, they might be about the perceptions of patients, as was rightly said. They might also be about how prescribers make decisions. What are the perceptions of prescribers about what's appropriate or rational use of antibiotics? And why are guidelines not followed? So we might have done an audit and found that actually in our hospital or a healthcare setting, guidelines aren't being followed, and we might want to try and understand why. So that's a more qualitative approach. Okay, I've just got one more example, if you would want to put the comments in the chat again. And this one is about adherence to medication. So what would quantitative research establish, and what would qualitative research establish? And I'm just coming out again so that I can go into my chat box to see if anybody puts anything in there. I'm just going to give a couple more minutes in case anyone's typing. Okay, great. So we've got quantitative will be the degree of adherence, and qualitative might be the reasons behind the adherence. Lovely. So yeah, as if you're going to ask about people's perceptions. So again, we've got quantitative, how many patients are non-adherent. Also, you might look about whether it's associated with certain patient characteristics. And it might be about, well, whether a pharmacy intervention can actually improve adherence. So qualitative research might investigate why patients are non-adherent to their medication, which is excellent. We had that in the chat, but also why a pharmacist intervention worked or didn't work, which will then help us to be iterative and design a better intervention in the next time. So why do we want to do qualitative research? Well, we've started talking about that already. It gives us richer data. So if you do a sort of questionnaire study, you'll just get a yes, no, agree, disagree, but you'll get much richer data with qualitative. It can be useful when there's been not much previous research in an area and you're trying to explore it for the first time. It can be useful to be together with quantitative methods. And again, it's answering why, how, and in what way questions. And it is increasingly used as part of healthcare research. Sorry, just trying to get my slide to move on. So commonly used qualitative methods. You might have interviews and focus groups. You might also have qualitative observations as well. So let's start with interviews. So there's three types of interviews. You can have interviews which are very quantitative. Those are structured interviews. You can have interviews which are semi-structured or unstructured, and those are more qualitative interviews. So a structured interview isn't really a qualitative research method. It's like a questionnaire, except instead of having people to self-complete it, you're asking them the questions. But it's mostly going to be closed questions. It's going to have a very fixed sequence and a predictable range of answers. sometimes people think if you have one or two open questions in it, that makes it qualitative. It doesn't really make it qualitative, because people aren't going to write loads and loads of things in there. You'll just get a few words. So it is really more about looking at percentages and numbers of people who say specific things afterwards. Then a semi-structured interview is the one that I generally use. And it covers topics relevant to the research. It will use very open questions, but it will be more flexible. So because you're not calculating an exact number of people who said certain things, you're looking more to understand the range of opinions people have. So if people say something and they say it out of order, it doesn't really matter if it's not exactly the same for each person. You can also prompt based on what someone said and follow up and ask people to explain a bit more so that you're getting more rich data. And you'll often have prompts to get further responses. There's also an unstructured interview type. Now, I've never used this, but I have once been interviewed by someone using an unstructured type, and they just had one question, and then they just sort of followed up based on what I said for the rest of the interview. So that's sort of the difference between them. So we're really thinking probably mostly you'll do semi-structured, you could do unstructured. I mean, you might do structured, but then that would be a quantitative approach. So I hope that's clear. I can't actually see the chat box while I'm sharing my PowerPoint. So if there's anything urgent that comes up, Ernie, if you could let me know. So talking about now qualitative interviews, there's different stages involved in doing one. First of all, you've got to decide who you're going to interview. So you're going to have to develop your sampling strategy, and we're going to go into that soon because it's quite different for qualitative versus quantitative research. You're going to then develop your interview schedule, topic guide, so that's your questions and prompts. Then you conduct the interviews. Then the next stage is transcribing it word for word. And these days there's a lot of software tools to help with that. Then your analysis, and then your write-up. So it is a process like anything else in research. So how do you sample? So we often use what we call purposive sampling in qualitative studies. So you're not going to be able to get a sample that's completely random and representative of the whole population. You've got quite a small sample. So you need to think about what's your research question and who will help you to be able to answer that. Who do you need? So it might be if you're looking at a particular condition, then you're going to target people with that condition. Or it might be you've got a more general study and you want to target people with a few different conditions. Again, is your research question to do with a specific population in terms of their age, their gender, ethnicity, location, or is it more general? Is it for people with particular medication or not? So you need to be able to think about who you need. And it might be that you do a few interviews and then you think, you know what, that was really interesting, but to find out more about this, I need to interview this type of person. So then you'll look for that type of person. So it doesn't all have to be completely fixed at the start. And it might be theoretically informed. You're developing a theory based on the interviews you've done, and then you work out who you're going to speak to next. So that's purposive sampling. One form of it is called maximum variation sampling as well, which means that you want a very varied population. So you'll try and get people with different conditions, different ages, different genders. But it all depends on what your starting point and your aims and objectives are in who you'll target. So who are you going to interview? We talked about. So you might use purposive sampling. It's always going to be non-probability, so that means non-random. You're making a decision on who you need to include. You'll have some predefined criteria. And there's something we call saturation sampling. And that's when you decide how many people to interview. And saturation sampling is when you come to a point where you think, I've been interviewing different types of people that I I'm not getting any new information now, so I don't need to interview more people. And that's called saturation sampling. There's also something called information power that you might use if you want to try and predict in the beginning based on, have you got a broad research question or a narrow research question? Is it something which you are you an experienced interviewer, or are you going to need to take some time to get familiar with the interviewing techniques? So those sorts of things as well might feed into your predictability in the beginning of how many people you might need, but it is very iterative as you go along as well. So saturation sampling is when there's no new themes emerging, and we talked about snowball sampling will be used if you have somebody you interview, you're looking for a particular group, and then you interview one person, and then you ask them for more ideas of who to interview next. So an example of, say, when I've used snowball sampling is when I've had, for example, I wanted to find out what medication safety interventions were being implemented in various hospitals. I didn't know who would have that information, but the starting point was the medication safety officer. And then they told us who it would be that would also have that kind of information, because they would know who was in the groups. And then we sampled them. Sample size is always much, much smaller for qualitative than quantitative. It takes quite a while to do an in-depth interview, and it takes a long time to analyze the data. So you're not going to have a very big group. I would say maximum usually about 30. It can be as small as 10. So again, it will depend on your research question as well. So I'm just going to pause a second to check if there's any questions so far. I can't see anything in the chat. So I'm assuming we're okay so far. So I'm going to carry on, and then maybe we'll take some questions later on. So I'm going to talk about the semi-structured interview schedule. That's the one you'll probably most commonly use. So you have 3 sections to developing your topic guide. First, you have what we call the brief, which is your introduction. Then you'll ask the questions, and then you'll have the debrief. So for the brief, you'll want to introduce yourself to the study, obtain permission to record, explain about confidentiality and anonymity. Even if it's already been in an information leaflet for the study, it's good to reiterate that at the beginning. It makes people feel more open and able to talk to you, and reassuring people that it won't have any impact on what they say on their ongoing and future clinical care. You also might want to tell them approximately how long it's going to take, and check they know if they're uncomfortable with any of the questions, they can just let you know and you'll skip those over. Normally the last thing I would say is it okay if I now turn on the recording? So we're going to go into these in a little bit more detail. So how do you introduce yourself? My name is, I'm a student or a staff member based at, and I'm carrying out a project about. Obtaining permission to audio record. So is it okay if I record this interview today? And what I normally do is explain why I'm recording it, because otherwise people might get worried about how this recording is going to be used. So it's just to tell people it's so that I don't have to write things down as we go. I can concentrate just on you, and that only who's going to have access to this. So it might be it's only me, it might be it's me and one other researcher, it might be it's me and a transcriber, professional transcriber that I'm using. But it's really to give that reassurance about why you're recording them is quite key as well. The next thing is to explain confidentiality and anonymity. So everything you say will be treated as confidential, but explain what that really means, because people might give you a lot of personal information in the interview. So you want to tell them that you're going to take out and change any names you mention. And that also that you're going to put all the things they say together with other people so that they won't be identifiable. reassuring them that no impact on future care. So if you're completely independent from the clinical team, it's worth telling them that as well. And then the duration, skipping questions, and okay to begin. So this interview should take about however long it takes. Please let me know if you'd like to stop the recording, if you'd like me to skip onto the question at any time. Is it okay if we start now? So that's the bits, and it's always, you may feel that these are obvious things to say, but it's always helpful to write them down, because when you're in the moment, you could forget exactly what you're saying and how to begin the interview. So having this approach to the beginning and writing it down is quite helpful, I've found. So then there's the interview questions themselves. So these are some questions that I've done from one of the studies that I did, which was looking at patient health records about medicines and whether people carried their own information about medicines. So I started off, these are just a few of the questions, asking people what records they keep about their medicines, what made them start keeping it, and how the use of it has changed over time. And then you can see I've put in a series of prompts there, because it might be difficult for people to think about what I mean by how has the use of the records changed over time. So asking people if they've added more information, if they've removed information, maybe they've changed format, for example, from paper to digital. So all those things are are like prompts for the question above. So I think we have a few minutes. What I'm going to suggest is you think about if you were writing maybe one or two questions for an interview on what it means to be healthy, or what does being healthy mean, or what are people's healthy practices or healthy behaviors that they do, and you want to interview them about health. Just think about one or two questions, put in a few prompts, and then we'll just give you a couple of minutes to maybe write down a couple of questions. And if anyone wants to share any questions in the chat, that would be great as well. Okay. And I can see we've got a question in the chat as well, so we'll come back to that. Very good question. Okay, just give them one more minute to see if anyone wants to put any of their questions in the chat to share. Okay, I can't see anything in the chat now, but if people want to put their questions in as we go, we can come back to those later. In the meantime, I want to come back to this question about the sampling, which is a really good question. Aren't we introducing, by purposefully sampling, are we not introducing a level of bias into our study? And are we deliberately, purposefully selecting participants to get our intended results? What I would say is that we're not deliberately selecting participants because we think they'll have a point of view. We're deliberately selecting participants whose point of view we need to find out. So, for example, if you wanted somebody's experiences of a clinic, a specific pharmacy-run clinic, then you're going to talk to people who go to that clinic. If you find that, some of the viewpoints you get, you think are specifically because they're people who are working in a hurry, they complain about, that it's all taking too long, then you might decide, actually, do we also need to interview some people to reduce bias? Let's speak to some people who may be retired, who may be less busy, who may want something different as well. And they might also say, no, we didn't need all this, it was all too long, or they might not. So it's about making sure that you reduce bias by having the range of people that you need and who can answer your question, rather than thinking, I want this person to say this, so therefore I'm choosing them. It might be things like people have said certain things based on a particular condition, but this clinic is for 2 different conditions. So you want to actually make sure that you get other points of view for people with other conditions to see if it's specific to that condition or not. So I hope that answers your question, but feel free to ask a follow-up question if you want. So the next one, we've now got in the chat. Is it okay if we use a note? How have you been feeling lately regarding your condition? Do you feel better or worse? So I think, how have you been feeling regarding your condition? Or you might want to specify what the condition is. How have you been feeling lately would be good. Do you feel better or worse? I would probably change slightly, although it's a good question because it's quite a closed question. And for a qualitative study, we're really looking for more open questions. So you might ask, have you noticed any changes in the way that you feel? And then you might have some prompts. In what way might you be feeling better? In what way might you be feeling worse? Okay, I can see that there's some more questions coming up, but I think that at this point, I will go back to the presentation and finish that off for a little bit, and then we will go back to some of these questions after that. So the next bit, you've got your brief, we've talked about the questions, now we're going to do the debrief, which is shorter. Just remember to thank people for taking part. And also answer questions that came up in the interview. Sometimes people will want a conversation and they'll want information from you, but as a interviewer, you don't want to be leading them in any way. So what you might do is say, is it okay if we come back to those at the end? And then when you've finished asking all your questions and there's no risk of you biasing them, then you can answer those. So remember to come back to any of that at the end as well. How to prepare for a research interview. Okay, so familiarize yourself with your interview questions. Try it out on a colleague first so that you get confident. Think about why it may be appropriate. So somewhere where the participant's going to be comfortable, but also try not to go somewhere too noisy if you can help it, because it will be difficult to get the recording. Make sure you've got all your equipment, your digital recorder, your batteries, your consent forms, any refreshments, anything that you need. Having spare batteries is always a good idea. So then when you're conducting the interview, you want to try and you and the person you're interviewing be as natural as possible. So look for so the audio recording can kind of be a bit intimidating, so try and just ignore it. It is tempting to just keep looking to check it's still recording, but try not to do that too much. You might want to write some notes, but not so much about what they're saying, but some contextual things about, maybe their facial expressions or, what's going on in the room, things that won't be captured on the recording. It can be difficult to have silences. We experienced that a bit when I've asked questions to you now and we were just sitting there, and there can be a need to sort of fill the silences, but it's not really good to do that because sometimes people need silences to think. So if they want to think a moment, just let that happen. Try not to interrupt people. So make sure you're using open questions, that you're using a good pace, you're allowing enough silent time. Show active listening, which I'm sure you've learned in other areas of being a pharmacist, and your body language, and try not to ask leading questions because we're trying to get their viewpoint as well. So what can go wrong in interviews? Well, I can tell you based on what's happened in the over 25 years that I've been doing interviews. Right, the recorder stops working, or you find out at the end of it that it hasn't worked because the batteries had run out, or you didn't have enough time storage left, which can be a very annoying thing to happen. So always make sure that you've got new batteries in, or it's charged up. Really important. It can sometimes, some people are very quiet. It can be hard to get them talking. You might have to use a lot of prompts to encourage them to talk. Some people, they might not stop talking and they might be going off on a tangent, and you've got to try and politely bring them back to your question. You might get people interrupting, particularly when you're doing things with healthcare professionals. They might not have time to come out of their clinical duties. They might get beeped. People might need them for things. So you have to work around those things as well. And then, try not to anticipate what they're going to say. Try and be as open as possible. So those are some of the things that can go wrong, but it all is about practice and experience. That's why it can be good to try it out with your colleagues a bit first. And you can maybe ask one of your colleagues to be really quiet and not talk much, and another one to keep going on the wrong subject. And then that way you'll have practice in dealing with both of those before you actually do your actual interviews. So just wanted to talk a little bit as well about focus groups. So that's when you have a group of people that you're interviewing rather than a one-to-one. So you get data from the group discussion. You'll also get data from the way people interact together. So an example of that is, again, that patient-held medication record study, where I asked people about what I had people in the focus group asking about whether they kept records of their medicines, and why not. So the really interesting thing that happened is some of the people said in the group, I keep information about my medicines so that people, the healthcare professionals, will know what I'm taking, because I've noticed that they don't always have the records. And the other people were saying, oh, well, I thought that the NHS was all joined up. The NHS is our UK health system. that everything was joined up. Maybe it's more joined up than it is in Indonesia, than it is here. And that's why they didn't keep any records of their medicines, because they thought there would be the information. And then the other people were saying, no, that it isn't joined up. And then they were saying, oh, now I know that it's not joined up. That's why I'm going to now keep information about my medicines. So that gave us an idea of really understanding that this was a key barrier, that people didn't know that this was needed from them, in order for the healthcare professionals to have a complete view of their medicines. And it also told us that once they found out that actually their assumption was incorrect, they would start keeping it. So that's already telling us that an important intervention might then be to raise awareness that the healthcare system records aren't presently joined up, which we might not have got just by interviewing people alone, but we got it between that interaction. So that's really useful. 8 to 12 participants you probably invite. I mean, sometimes now we do them online, then you might want a few less, probably 6 to 8. And you always have a co-facilitator with you. So there's somebody to check the recordings are working, to if anyone needs a comfort break, to show them where the toilets are, to be writing some notes. I mean, it's quite a skilled thing to be facilitating a discussion. So you need someone else to take care of all the practicalities for you. And sometimes they might come up with a question they want to follow up on as well. So that's group interviews. So again, you'll have your interview guide. The additional challenges in doing a focus group is to make sure that you're valuing all contributions and you're treating everybody's contributions as equally valid. And you're eliciting contributions from all participants. So you might have people who are very dominant and want to talk a lot, and I'll often say something, you need to be polite. It's been really interesting to hear about all your views. I'd really like to hear what other people think about that as well. Obviously, you don't want to force people to answer questions, but you want to make sure that they've been given the opportunity. And it takes a lot longer, so you'll have 1.5 to 2 hours. And then I just wanted to also touch on observation studies. So they can be participant or non-participant. So that it depends on whether you're a person, a healthcare professional on a ward round already, for example, or you're part of the group, or you're coming in as an outsider researcher into the group. So it's about observing how people behave rather than just how they say they're going to behave. And you can see people in their own context, and you'll have a protocol for recording that. An example of when we did this methodology, qualitative observations, were when we looked at patient involvement in their medication safety while they were in hospital. And we actually observed some interactions between healthcare professionals and patients and carers about medicines to see how they were being involved, rather than only talking to people about how they thought they involved them. So that was a really interesting and added to our findings as well. So when you conduct observation studies, you need to have some sort of protocol for what you're trying to observe. Train people about consistency and reliability. And sometimes when there's been more than one person doing observations, I've done one where we both observed and wrote down our notes to check we were observing the same sorts of things. You have to explain fully to participants why. Sometimes people are worried that then people will change their behavior, but you need to deal with that in another way. Very rarely will ethics committees allow you to use deception and not tell the people why you're observing them. Again, confidentiality and anonymity. Also, be careful where you are. You want to be unobtrusive. The more you position yourself where you're very obvious, the more people's behaviors will be affected by the fact you're there. So obviously you need to be able to hear and see what's going on, but you also need to be unobtrusive. So try and think carefully about where you're going to place yourself in the room. So these are some of the advantages of interviews. You might get richer data when you can only concentrating on one person. and get more in depth. They're also better to do interviews if you're exploring something very sensitive that people might not want to be sharing in a group. But the focus groups, they give you the group dynamics, they give you the data from multiple people, and this social interaction might be really important, like I outlined before. So the focus groups can be more difficult to arrange because you've got to get lots of people all available at the same time. You've got to manage the dominant participants. They are more difficult to transcribe because you might have people talking over each other. You might have a lot more background noise, and you do need a very skilled moderator. Obviously, once you've done the focus group, you're doing a lot of people in one go, so it could be less time consuming than going to everyone individually as well. And there might be room for bias as well of you as an interviewer, which is why you need to make sure you're not asking leading questions. So just very briefly want to go on to how you analyze the data. It's impossible to cover this in the time we've got. But instead, again, we're looking at words, we're not looking at numbers. So you're identifying relevant themes, things that you think are noticeable. Then you'll pick out and highlight what text is it that is important within that theme. What is the text that illustrates that theme? Then you might also have a look for ones that are different from that. And you'll get an emerging framework by looking at the different points of views. And it's important to ensure you've covered the full range of viewpoints expressed. So I always say to people, the difference between being a qualitative interviewer and a journalist is you're not looking for this one new top headline. You're looking to make sure even the most minority views that's only said by one or two people are incorporated, so you've got the full range of views. So you might have come across validity in relation to quantitative studies. For qualitative studies, validity is really important, but it's slightly different. So you'll look at validity by re-examining your transcript and specifically look for things that don't fit your main findings to see is there anything there that doesn't. You'll look at how your findings fit with what's already known. That's called cumulative validity. Sometimes people recontact the participants to see if they agree with the way you've interpreted their findings. And you might modify you can actually in qualitative modify your schedule to test emerging theories. Again, a way that we did that once in a study was that we found in that patient-held information about medicine study that a lot of the patients' records didn't have the indication of their medicine. And that's something that a lot of healthcare professionals said would be really useful. So then we changed it to add a question about whether people would be comfortable to add the indication on, which hadn't been an original question on that interview, but we asked because of the emerging evidence of a difference between healthcare professionals' preferences and patient practices. And also, as anything, you still need to think about who's missing, who might not have agreed to take part in your study, and account for them. And then reliability is having more than one person involved in the analysis and in the coding as well. So to look for some consistency there. I've just put a few references there for some further reading and books. I'm very happy to share my slide set so that you can access those later. So I'm going to just go back to the chat because I know there were a few questions in there.
Yes, thank you, Dr. Garfield. There are many questions, I think. we can go through the questions. Maybe for the first one is from Mustika Dewanti. Hi, Dr. Sara. I have a methodological questions regarding my qualitative research. I am developing a semi-structured interview guide based on the constructs of the selected regulatory and implementation framework. Would it be methodologically acceptable to derive the interview questions directly from the framework without conducting a separate instrument validation process? So the validation process. Alternatively, would you recommend expert review or other forms of validation before the data collection? I would appreciate your thought on this approach.
Yeah, I think that's important. I think the thing to think about is the framework isn't actually your questions. The framework is informing your questions. So it might tell you what you want to ask questions about, and that's fine. But it might not necessarily tell you how to ask that question to make sure that you're being open, to make sure your question is clear. So you would probably also still want to have some sort of validation of the way you're asking your questions, which is really important as well. And also you might want to think, well, you've got this framework, but is there anything else that you also want to add in outside of the framework to the questions? So I would say it's a good starting point, but it's not the end point.
So how many validators usually to do like an expert judgment for the validation process? Are there any recommendations or
So
something?
it's a little bit different to quantitative. We don't have
Um,
a specific number of people. More we want people to represent different areas. So it all depends on what your research question is. So if all your research questions are going to pharmacists, then you might want to have a range of different pharmacists, but you might also want to think about what other healthcare professionals might want to know about the pharmacists as well. And at some point, you need to decide: do you want a patients and carers involved in validating your study to check that it's got in there what's important for them in your schedule as well, even if you're not interviewing patients. So it's more about, again, with qualitative, not a precise number, but the range of viewpoints that you need to inform you.
I see. So actually, there is no exact number, and for the qualitative research, is it also we need to count like the content validity index, like in survey, something like that, or it is not essential for the qualitative research?
Again, it's not about numbers, but it's about
Okay.
people looking at it and saying, does this cover what we want it to cover? So you still can do content validation, but just in a slightly different way in terms of thinking, is there anything missing here? And that's why it can be good to get a range of different people. There might be something, for example, that a patient thinks of that's really important to them that we might not know about as healthcare professionals.
Okay, I see. Because sometimes students might be mixed up using content validity index for the interview. So actually, it is not compulsory for the qualitative research, right? Yeah.
That's right. I mean, you need to think about all these things, but you might not use an instrument in quite the same way.
Okay. Thank you very much, Dr. Garfield. And next we have the second questions. Hello from Karina Puspitasari. Hello, first, since I am using semi-structured in-depth interview, is there a minimum interview duration that is generally considered adequate? For example, if all of the questions have been explored through, but the interview only lasts around 20 until 30 minutes, would it be acceptable? That's the first
Uh,
one. And yeah, maybe that
Maybe
one.
I'll answer that one and then we can move to the next one. But yeah, I mean, it's not a specific time frame, and they can be very different between different studies, between different research questions. So I would say an acceptable time would be that the other person hasn't been rushed, that they've been able to answer all the questions, that you've been able to get their opinions on everything, rather than it's lasted for a specific amount of time.
Okay, thank you.
20 to 30 minutes, for some studies would be perfectly sufficient.
So it depends on the study actually, right? The
The
research
study
question.
and also how much someone's got to stay. Sometimes in the same study, I might have someone who talked for 15 minutes and someone who talked for an hour because they had a lot more that they wanted to express. But as long as you've made sure that people have had the opportunity to express everything they wanted to, that's what's really key.
Okay, and the second one is regarding the number of informants. I understand that qualitative studies usually determine sample size based on data saturation. Is it acceptable to stop recruiting participants once data saturation has been reached, rather than aiming for a predetermined number of informants? Thanks in
Yeah,
advance.
definitely you can do that. Everything in qualitative research is iterative. And actually, if you've already got enough information, it's not ethical to keep asking for more people to participate. So, yes, if you feel that you've got enough, you can stop. The only reason that we sometimes need a predetermined number is because of funders and trying to work out how much time and money that you need. It's a more practical thing, but actually, it's better just to be iteratively deciding as you go along what you need.
Okay. And the third question is from Indri Yuliani Hamdani. Is it okay if the patient gives a very detailed answer, or is it better to use a rating scale? For example, on a scale of 1 to 5, how would you rate your condition before starting the medication and after taking it?
So that second rating one is not a qualitative question. That is a quantitative question. You're asking people to give a number. So the first example with the more detailed answer would be the qualitative one. So it's not that using the second one would be unacceptable, but that's not a qualitative methodology. And it depends again on your research question. But if you're doing a qualitative methodology, asking somebody on a rating scale won't give you the words that you need. It will only give you the numbers.
Okay, thank you very much. And the fourth question is from Marce Ingrita. Dear Sarah, for the FGD with specific and small participant numbers, can we still guarantee anonymity? How do we overcome this for the anonymity?
Really good question. So, one of the things that you need to do is maybe not give out so much information. So, if you've got small participant numbers, you won't want to give lots of context to them. You might just say they're a patient, they're a doctor, they're a nurse. So, especially if you've got quite a small team of healthcare professionals, so it's you might then not say which team exactly. You might anonymize the hospital, the trust. So it's maybe sometimes anonymizing beyond just the person itself, but the organization they work for. It's about looking through the interview and checking have they mentioned anything that could identify them and taking that out. So if they mention who their wife is, then you'll just put name of wife instead of that. So there's lots of different techniques we use to try and anonymize a transcript.
Okay, and the last questions, I think, for this from Indri. In a FGD, when exploring the perspective of nurses, doctors, and pharmacists, is it better to have a mixed interprofessional group or separate FGD for each professions? Yeah, I think this is frequent happen. What factors should we consider when deciding between this approach?
Well, you're going to hear the same thing I've said for other questions, but it really does partly depend on your research question. So, are you trying to compare the different groups? Are you trying to isolate them and then compare them? Or are you trying to have that in depth discussion between the different groups, which might be important? One of the things you could do is do a first round of separate groups and then have some mixed groups so you get the best of both worlds. But the other thing to really consider in this is the power dynamics. So, is our nurses not going to talk as freely if they're with doctors in the same room, particularly if they've got a challenge related to the doctors? So it's also about thinking, as well as about your research question, about what's going to help people be more open. Maybe this interaction between them might be important, but if there's hierarchical structures, then actually maybe it'll stop people being able to open up as much. So that's another consideration as well.
Okay. We still have questions. Is it okay?
Hey, yeah, that's okay. I've got a few more minutes
Yeah.
if other people have.
Yeah, this is from Kartika Chitra. Hi Sarah, what do you think is the best way to report that data saturation has been achieved in a qualitative study? Some people argue that claims of saturation are not always well supported and be quite subjective. I was wondering if there is a more robust or transparent way to present the saturation of data.
I think that's really important because how do you know that if you didn't keep interviewing, you wouldn't get other opinions? So I think it is really important to look not just about what people are saying, but who you've interviewed. That's why you have to continually be evaluating this. Is there somebody else, even if everybody's telling you this no new things, is there anyone else who could you could interview who might have a different opinion and who you've missed? So that is important. And also, so increasingly, people don't use theoretical saturation on its own, but also think about looking at things like information power. I can send a reference to you after on that to send around, which is also another way of thinking about sample size. So you might use those two approaches together.
Yeah. Okay, I think that is all from the chat box. Maybe if you don't mind, I have one more questions.
Yeah, sure.
So usually in qualitative research, sometimes we find that there is encounter inconsistencies between interview data and also observational findings. How should researchers deal with these discrepancies? Should we use only one source of data be considered more reliable than the other? Or should both be interpreted together to gain a deeper understanding of the phenomenon? Because
Yeah.
sometimes when we found the discrepancy.
So sorry, which were the two methodologies you were asking about?
Using semi-structured interview and also observation. Sometimes we mix it. So which one is actually better if there is a discrepancies between both?
Yeah, I think that it depends what you're trying to find out. If you're trying to find out the way people behave, then watching what they do is sometimes more reliable than thinking about how they say they're going to, what they say they do. So people might want to say that they always carry out certain safety procedures and they might not actually do it in practice. So I think for actual what people actually do, an observation can be more reliable, but an interview would be better for thinking about people's perceptions of why they act a certain way, for example, or what their views and opinions are. So I think that they will give you different data, so it depends on whether you want to know how they behave, why they behave, or both.
Okay, so it depends on the context of the questions, right? Okay.
Yeah.
For the yeah. Again, maybe the last questions for today's session for qualitative research from Dr. Herman Suryadi. Is interview better than a making questionnaire?
For qualitative research, yes. If you write a questionnaire, people will answer quite briefly. You'll get much better information by interviewing them. And it's also more inclusive of people with different literacy skills. But yeah, if you ask someone to write something down, you'll get one or two sentences. If you ask them to talk, they might talk for a few minutes. So I don't think of questionnaires as, even if it's an open question, as qualitative research. It's not really got that depth to it.
So for the questionnaire, even if it is like open-ended, we cannot count it as a qualitative one.
No, it's one of my bugbears. Yeah, because
Ah,
often when it's open-ended, the amount of information you get will be very limited, and you probably won't be able to analyze it in a
mm.
qualitative way. You probably just put it into themes and have to number how many people had a specific viewpoint in the end.
So I see, because sometimes we regard it as qualitative in open-ended questionnaire. So
Mm.
okay, thank you very much, Dr. Garfield, for the time. It is very insightful presentation and nice discussion. So yeah, I think once again we would like to express our sincere gratitude for taking the time to share your valuable knowledge and experience with us today. I also thank all the participants for attending today's international guest lecture. Maybe before we ended our session today, we can take a photo together. So please, for all of the participants, you can open your camera so we can take a pictures together with Dr. Sara Garfield. Okay, so yeah. Okay, for the first one, maybe Dr. Sara Garfield, can you please
Oh, I'll
comment
stop
down?
sharing
Yeah,
it, Mike.
yeah, stop share. Okay. So first for the first slide, 3, 2, 1, cheese. Okay, and the second one, 3, 2, 1, cheese. Okay, thank you very much, Dr. Garfield, for the time. We have today's session has inspired all of us to explore qualitative research more deeply and apply this approach in our future research and professional practice. Should you have any further questions, please feel free to contact the organizing committee. On behalf of the Faculty of Pharmacy Universitas Indonesia, thank you once again, Dr. Sara Garfield, for joining us and all of the participants. Stay safe, stay healthy, and we look forward to seeing you in the future academic events.